Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I am David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you, as always, for taking the time to join us. We would like to recognize that our work takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. We also acknowledge the many Indigenous communities that have been forged in urban centres across Alberta. Our board members are joining us from across the country, and we acknowledge the Indigenous people's territories in which they live and work. Today we have several motions for consideration from the board's various committees. First, I would like to pass on the board's deep and sincere appreciation for AHS teams across the province for their hard work, care, and compassion throughout the most significant public health crisis of our lifetimes, indeed generations. COVID-19 has been unrelenting. We are coming up on 9 months since the first confirmed case of COVID-19 in the province, and we know our pandemic response will extend many months into the new year. This year, more than 1,500 Albertans have been hospitalized, and as of today, 510 Albertans have died. Our thoughts and condolences go out to those who are grieving for them. Throughout it all, AHS teams continue to provide safe, outstanding care for Albertans each and every day. Albertans have shown their appreciation for these healthcare heroes throughout 2020, and we can't express often enough our gratitude and respect for those on the front lines. To AHS staff, physicians, and volunteers, I thank you again, personally and on behalf of the board. We can never thank you enough for your courage and dedication, and for always being there for Albertans when we needed you the most. Next, I would like to address administrative matters. In keeping with provincial guidelines, we are not meeting in person. We are participating by telephone conference today. Accordingly, we can't see each other. When I ask for a vote on a motion, I will ask for those opposing or abstaining from the motion. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
It's Brenda. I shall move.
Thank you. Will someone second the motion?
David Carpenter.
Thank you, David. Is there any discussion? Are there any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. You've all seen the minutes from our last meeting on October 8th, 2020. Are there any issues or questions? May I ask that someone move approval of those minutes?
That's Steve Mandel. I'll move the minutes.
Thank you. Will someone second the motion?
Hugh, I second the motion.
Thank you, Hugh. Is there any further discussion? Any opposed or abstentions? Motion is carried. Thank you very much. Like AHS staff, volunteers, and physicians, the board continues to be very busy. Each of the board's committees met at least once during the month of November. The following reports address recommendations coming from some of those committees. I will ask David Carpenter, as chair of the Finance Committee, to start us off by presenting the Finance Committee meeting report.
Thank you, Mr. Chair. The Finance Committee met on November 12th, 2020. As chair of the Finance Committee, I'm presenting 4 motions for approval today. First, second quarter 2020-2021 investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The committee was presented the second quarter 2020-2021 investment report and recommended that the board ratify the transactions. The board reviewed the recommendation and members support the approval. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from Alberta Health Services and Phillips, Hager and North Investment Management. A, as at September 30th, 2020, Alberta Health Services held restricted and unrestricted funds managed by Phillips, Hager North Investment Management and Manulife Financial totaling $855 million. B, funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended September 30th, 2020 were invested in accordance with the investment bylaw and investments policy. I so move.
Thank you, David. Will someone second that motion?
I'll second that motion, Brian Vasjo.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. David, your second motion?
The second item considered was a proposed amendment to the Microsoft Enterprise Agreement between Alberta Health Services and Microsoft Corporation. Committee recommended board approval. Board reviewed the proposed amendment and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the following. Firstly, the proposed amendment to the Microsoft Enterprise Agreement between Alberta Health Services and Microsoft Corporation, effective December the 1st, 2020, on the terms and conditions as reviewed by Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And secondly, the delegation of authority to the President and Chief Executive Officer to execute the above amendment on behalf of Alberta Health Services in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
It's Glenda Yates. I'll second that.
Thank you, Glenda. Any further discussion? Or any opposed or abstentions? The motion is carried. David, your third item.
The third item considered by the committee is the Furniture and Equipment Information Technology Program Master Agreement for major health capital projects. The committee recommended board approval. The board reviewed the proposed agreement and members support the approval. Accordingly, I move that the Alberta Health Services Board approve the following. Firstly, the Furniture and Equipment Information Technology Program Master Agreement for major health capital projects between Alberta Infrastructure and Alberta Health Services for a term of 5 years, effective as of the date of execution, on the terms reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And secondly, the delegation of authority to the President and Chief Executive Officer to execute the above agreement on behalf of Alberta Health Services in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
This is Vicki Yellow Old Woman. I second.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? Motion is carried. David, your fourth item.
Lastly, the committee reviewed the renewal and amending agreement for peritoneal dialysis products and home delivery services with Baxter Corporation. The committee recommended board approval. The board reviewed the proposed amendments and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the following. Firstly, approve the renewal and amending agreement for peritoneal dialysis products and home delivery services with Baxter Corporation for the term ending on June 30th, 2022, on the terms reviewed by the Finance Committee and the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And secondly, the delegation of authority to the President and Chief Executive Officer to execute the above renewal and amendment on behalf of Alberta Health Services in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
Sai Zolkier, second the motion.
Thank you, Sai. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Dr. Brenda Himmelgarn, as Chair of the Community Engagement Committee, to present the Community Engagement Committee's report.
Thank you very much, Mr. Chair. The Community Engagement Committee met on November 13th, 2020. 4 items the committee considered are being presented today for board approval. 2 of these items are with respect to the appointment and renewal of advisory council members and the appointment of trustees to established foundations. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. First, the appointments and renewals of members to advisory councils and the appointment of the chair of the Sexual Orientation, Gender Identity, Expression Provincial Advisory Council. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee and approve the appointment of the chair of the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to the advisory councils and the appointment of Jennifer Kellner as the chair of the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. Will someone second the motion?
David Carpenter.
Thank you, David. Any further discussion? Any opposed or abstentions? The motion is carried. Brenda, your second motion?
Second, with respect to the appointments and reappointments of trustees to foundations, the responsibility to appoint trustees to establish foundations lies with the AHS board. The committee recommended the board approve the trustee appointments and reappointments as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and reappointments of trustees to health board foundations for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. Will someone second the motion?
Stephen Mandel, I'll second the motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. Brenda, your third item.
The third motion is with respect to the terms of reference and amendments to the amended bylaw for Alberta Health Services establishing health advisory councils for the 12 geographically located health advisory councils. Health advisory councils are established under the Regional Health Authorities Act for the purpose of advising the AHS board and AHS leadership on community health needs and priorities. In carrying out this role, the health advisory councils engage with residents to gather local perspectives about healthcare delivery in communities across the province. The committee considered newly proposed terms of reference for the health advisory councils and corresponding amendments to the current amended bylaw for Alberta Health Services establishing health advisory councils to align with these new terms of reference. Amendments to its bylaws for the health advisory councils are required to be approved by the AHS board and then submitted to the Minister of Health for approval. The amendments will be effective upon ministerial approval. The committee recommended the board approve such terms of reference and the corresponding bylaw amendments. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board, number 1, approve the newly developed terms of reference for the 12 health advisory councils established under the Regional Health Authorities Act and the amendments to the amended bylaw for Alberta Health Services establishing health advisory councils as reviewed by the committee and the Alberta Health Services Board, which such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 2, direct the board chair to sign the amended bylaw for Alberta Health Services establishing health advisory councils on behalf of Alberta Health Services and management to forward the same to the Minister of Health for approval. I so move.
Thank you, Brenda. Will someone second the motion?
Hugh Somerville, I second.
Thank you, Hugh. Any further discussion? Any opposed or abstentions? The motion is carried. Brenda, your fourth and final motion?
Lastly, the board members of the Calgary Health Trust voted to amend the organization's name from Calgary Health Trust to Calgary Health Foundation. The trust also voted to amend the objectives of its bylaws to broaden the scope for which the trust can fund projects and research. The Calgary Health Trust is an established foundation, and any amendment to its bylaws is required to be approved by the AHS board and then submitted to the Minister of Health for approval. The amendment will be effective upon ministerial approval. The committee reviewed the proposed amendments and recommended that the board approve the bylaw amendment. The board also reviewed the amendments, and the members support the approval. Accordingly, I move that the Alberta Health Services Board, number 1, approve the proposed amendment to the amending established bylaws of Calgary Health Trust to amend the organization's name to Calgary Health Foundation and to amend the objectives of its bylaws as reviewed by the committee and the Alberta Health Services Board. And 2, direct the board chair to sign the amended bylaws on behalf of the Alberta Health Services and management to forward the same to the Minister of Health for approval. I so move.
Thank you, Brenda. Will someone second the motion?
Glenda Yates, I'll second.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Hugh Somerville, as chair of the Governance Committee, to present that committee's report.
Thank you, Mr. Chair. The Governance Committee met on November 16th of 2020. The committee at that time considered 2 items for recommendation for the approval of the board. The first item is with respect to the terms of reference for the 6 AHS board committees. The board has established 6 advisory committees, namely the Finance Committee, the Audit and Risk Committee, the Community Engagement Committee, the Human Resources Committee, the Quality and Safety Committee, and the Governance Committee. The terms of reference of each committee is reviewed annually. There were no proposed changes to the substantive parts of any of the terms of references. However, the committee reviewed proposed amendments to the boilerplate language in all committee terms of reference and recommended that the board approve the same. Accordingly, I move that the Alberta Health Services Board, A, approve the amendments proposed for all committee terms of reference as reviewed by the Governance Committee and the Alberta Health Services Board, and B, direct that the revised terms of reference for each committee be posted on the Alberta Health Services public website. I so move.
Thank you, Hugh. Will someone second the motion?
This is Vicki. I'll second the motion.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? The motion is carried. Hugh, your second motion.
The second item is with respect to the reappointment of an external member to the Quality and Safety Committee. The Governance Committee was asked to consider and recommend to the Board for approval Dr. Brian Postal's reappointment as an external member of the Quality and Safety Committee for a term of 3 years commencing January 1st of 2021. The committee and the Board support the reappointment. Accordingly, I move that the Alberta Health Services Board approve the reappointment of Dr. Brian Postal as an external member to the Quality and Safety Committee for a 3-year term commencing January 1 of 2021. I so move.
Thank you, Hugh. Will someone second the motion?
Sai Zoki, I second the motion.
Thank you, Sai. Any further discussion? Any opposed or abstentions? The motion is carried. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you again for joining us. Please stay healthy and safe, keep others healthy and safe, and please follow provincial COVID guidelines. We'll get through this together.
Together, we do amazing things every day.